While others may still be joining us, I'd like to welcome all of you to the College of Pharmacy Virtual Town Hall, COVID-19 and Beyond. I truly appreciate everyone taking time out of their busy days, particularly under life circumstances now, to join us here. All attendees should note that your microphones are muted, but there will be a question and answer period afterward if time permits. We will address the questions first that we received prior to today's event. You won't have the ability to raise your hand, but you can use the question and answer function, and hopefully we can get to those. And then finally, please note today is being recorded, as well as closed captions are being auto-generated. Next slide, please. Today, what we'd like to do is talk about COVID-19 and beyond, particularly as it relates to the College of Pharmacy. And I'm Linda Welledge, and honored to be the Dean of the College of Pharmacy, and I'm joined by two esteemed colleagues, Janine Conway, the Associate Dean for Professional Education, and an Associate Professor in the Department of Experimental and Clinical Pharmacology. And then I'd also like to recognize Dr. Randy Seifert, Associate Dean for Student and Professional Affairs and Associate Professor in PCHS here in the college. We are going to go through and give a very brief overview of what we've been working on since COVID hit Minnesota and hit the university and the college, and what we've done. And then we're going to leave time, as I said, for question and answer. Next slide. I think everyone would agree, whether you think about it from your personal lives, you think about it from your businesses that you are in, the profession of pharmacy, or related to education, K through 12, higher education. And it's true for the College of Pharmacy. It is an amazing time of change, changing rapidly. What was we thought was true yesterday, science builds off of that, and we learn more and change our path as we go forward. And we'll share with some of you those experiences. But I want to stress, and we can't give a lot of detail today, but we couldn't do it without our partners. We've partnered with the university very heavily and with the health sciences, both in terms of our policies and ensuring our students, faculty, and staff and everyone is safe, but also in terms of ensuring we have continue to have high quality programs that now have to be offered in a different way. We also thank our collaborators from other colleges of pharmacy or across the world in terms of helping discover new cures and be at that frontline research piece or at the front line of educational discussions. How do we do this differently? Our preceptors have been instrumental in the whole thing in helping us ensure our students did graduate, and our P4s did last year. And maybe some are online now as alums, hopefully proudly. But really changing, how does experiential education look? And Dr. Conway will talk about that, but our health organizations, our professional organizations, and lobbying and advocating for the profession of pharmacy and changes in healthcare in general that are needed during this time. But our amazing students for being resilient, our faculty and staff for being creative and patient. But I particularly want to thank today all of the alumni and friends of the college. You have come out, you always support us. And during this pandemic, it's true, and it's on steroids, if you will. You provided video messages to our graduates, which meant a lot to them in that they had to have a different graduation. You've helped us create different ways of doing things when we've reached out to say, how might you do that? Or how does that work in your environment? And you've been there also to be a supportive voice, whether it be for the students, the faculty and staff, or even the dean. So I thank you very much. As we talk about things today, I want to stress that our first priority is safety. And we think of everything now through that COVID safety lens. We thought of it before, it's just a higher lens that we have, but it's not simply focusing on COVID-19. We have to get the safety right. But we also have to think beyond COVID-19 and think of what's going to be the future. How will things change in terms of pharmacy education, in terms of higher ed in general, in terms of the pharmacy profession? And so we're not looking at what we're doing today as a patch for just getting through COVID-19. We're looking at how COVID-19 shapes our future and helps us to be stronger and in the future. Next slide, please. And this slide just sort of summarizes it at a very high level, that it's really during this time period about innovation, leadership, adaptability, and partnerships. We have frontline clinical practitioners designing and supporting new models of care, some of that being telehealth, but also others. We are ensuring our students are practice ready, interprofessional team members, by designing new models of education, both in the classroom, but also in experiential education. How do you do teamwork when you're remote? We're developing new ways to support our students, faculty, and our alums, as well as staff. Developing, as I mentioned before, and pursuing new treatments and new cures for COVID and other diseases that devastate our society today. We've done small things, but have been helpful, such as supporting our communities and others with hand sanitizer. We've supported the profession and will always continue to do so by supporting legislative and advocacy efforts in a time where more and more individuals recognize the importance of pharmacists in stepping forward and having a role in COVID-19 and broader in healthcare overall. Next slide. The College of Pharmacy is also working with partners within the university, other health science schools, and our communities to address the social injustices, particularly following the death of Mr. Floyd, as well as the social unrest that has pursued in our society. These are just some of the preliminary things we're doing. It includes education, and whether that's education of faculty and staff or new curricular programs and extending it further. Convening conversations with our communities. What can we do better and how do we do it in a sustainable way? And then working with our communities, and under that, it's still in the preliminary stage, but I will say one thing you may have read about is our mobile health initiative that we're partnering with the health sciences on, and how do we go to communities and partner with them to improve health and health equity. And that provides sort of an overview, but now to get into the details of education, I'd like to ask Associate Dean Janine Conway to comment on the professional education program.
Linda, if you wouldn't mind, please enabling live transcription, that would be great.
All right, excellent. Well, thank you. I am very pleased to share some of all what happened in the last, I guess it's only been 4 months, I think, when I did the math. It seems like a long time. So in spring of 2020, essentially on March 12th, the university community was sent an email that immediately suspended all of our clinical education across the health sciences and directed us to shift all of our courses to remote learning. And so we very rapidly worked with faculty, and that was a heroic efforts by staff and our graduate assistants, our graduate teaching assistants, to support faculty in setting up their Zoom rooms and ensuring all the materials were on Canvas and organized. Based on feedback we got from students, we adapted our organization to ensure students could find what they needed. And so everyone learned rapidly how to navigate what it was like to work and study at home. And clinical rotations were adjusted to meet accreditation graduation standards. So at that point in our curriculum, we exceeded the minimums that accreditation required. So we were able to, in some cases, verify that students had completed what they needed to meet accreditation requirements. In some cases, we were able, in a number of student cases, we were able to quickly tailor to get them to the minimum of what they needed. And we built out some additional work for them to prepare for boards and to study to ensure they met graduation standards. And in the midst of designing all that, we worked with the public health officer, Jacob Toller, to ensure that we were doing the right sort of clinical exemptions for students and monitoring, for safety as they were out trying to wrap up their hours. And so that allowed us to get the class of 2020 to graduation. Next slide, please. So what did we learn? Well, we've learned some lessons I don't think we expected to learn. We learned that Zoom really allows for students to interact across campuses differently. What used to be, a bunch of people in the Twin Cities and a bunch of people in the Twin City or Duluth ended up being a whole bunch of people in a more shared common space online. And so we were able to do breakout groups that really facilitate discussions across the two campus groups in a way that we never really could do in our previous on-campus presence model with the two campus model. And we learned faculty interacted differently. One of the kind of needs that arose and faculty embraced was a whole new interest in teaching development. We started weekly teaching huddles, 30 minutes, and it was totally driven by what faculty needed and wanted to learn to work better in their new remote classrooms. And so that allowed us to do very rapid, responsive education on, how do we do team-based learning in Zoom, and staff worked with faculty to, figure out the most efficient ways to set that up and debug some of the challenges. We had a number of conversations about how do we do exams when students are remotely. And so the huddles allowed us to address some of those needs in a more rapid fashion than we previously operated. We learned we could administer exams in an online system. In this case, we administer them in Canvas, which is our learning management system, university system-wide. And so we worked through some of the challenges of what does that mean, and what does it mean when students aren't being directly observed, and what are we comfortable with. And we learned a lot in terms of going into the fall and how we're supporting faculty and even the advice and instructions we give to students to ensure that they're developing good study habits to help them succeed in this more remote learning environment. And then we learned in anticipating what the class of 2021 was going to need and how we might need to adapt to try our best to ensure that they all get their required rotations to be on track for graduation. We made some adjustments in terms of how we structure rotations, going from 5-week to 4-week blocks to create more blocks, to create more spots, to hopefully get students into all the required rotations. And uncoupling a few elements to allow a little bit more nimbleness in how we schedule students. And so we're still, we're only in the second block. It's still early. It feels like that all this planning went into it, but we're still sort of evaluating how well these 4 blocks are working. We're only on week 3 of the second block. So it's still early in terms of kind of understanding how that's going to work for the next year, or maybe 2, depending on what direction we think we need to go. Next slide, please. So going into the planning for fall, we are convening faculty by the cohort every other week to help coordinate logistics. We're really trying to view a semester rather than a number of independent classes, but really as a more cohesive unit to understand how courses are delivering their content. And so based on feedback from a a lot of our P4 students who are our current P4 students that have ended up on rotations with faculty and talking about how they felt spring semester went. We're planning on delivering courses in their planned schedule times, but being clear about what really requires attendance versus what is similar to what would have been delivered in a classroom, and it was going to be video captured, and then students can make choices about if they're going to attend or not. So as the provost came forward with directives and the faculty really met and started talking about it, the vast majority of our curriculum will be delivered remotely. We will do some blended course delivery, and that is primarily remote, but it also includes some in-person components, and that's primarily in our skills lab. As a number of us have been keeping tabs on accreditation requirements, there are certain competency elements that we need students to develop to demonstrate at some point. But certainly we're working with students in terms of, you know, unplanned life events and illness, and, you know, being flexible about if they're not comfortable coming to campus in fall, they can take an incomplete and come in the spring, and try and figure out how we support all the students in accomplishing what we all need to accomplish so that they can hopefully start their APPEs on time. Accreditation is clear. All their early rotations and previous didactic coursework has to be completed before they begin their advanced practice experiences. And so there'll be ongoing monitoring, particularly with our experiential curriculum. We check in every other week with both preceptors and students around COVID safety issues, and field those as appropriate. And I'm responsible for reporting to the Academic Health Center where our students are placed and what kind of issues we're encountering. We're encouraging faculty, that was our conversations this week, on preparing for backup teaching plans. As you know, that is one of those things with Zoom, though, that's made us more flexible. It used to be we really needed a faculty in Duluth and in Twin Cities, and if courses are delivered remotely, it's really two faculty and they can back up each other, kind of, because we're, you know, I think the dean has coined the term, we're infinite campuses now, right? We all work from where we are, and we're figuring out how to back each other up. We're in the midst of writing the procedures and protocols around as if when students develop COVID, how that builds in just with our current illness policies and procedures as well. And then continuing to sort of figure out if we need to make additional experiential education adjustments as we plan, particularly normally in falls when we'd start planning for the next year of experiential rotations. And so trying to figure out when those decisions still need to be made, and obtaining availability and those kinds of things. Next slide, please. So there are ways that curriculum has been responsive to just needs that have arisen because of the pandemic. And so I thank our colleagues at the University of Michigan who, as they were grappling with how to complete their class of 2020 year, they developed a COVID-19 remote APBE, and they were willing to share that foundation with us. And so we've been holding that. We're in the second block of educating the students, and they get to really dig into COVID and explore issues around testing and all the clinical trials and the bad information. And you know, and I've been teaching it, and it's interesting because it really evolves sometimes day by day. Something new comes out and we're adapting to review the newest things that we're learning. So it's been a fascinating experience. And then one of the things that has evolved as the Bethesda Hospital became the COVID hospital is M Health opened a strategic operations center, and Scott Chapman and others really stepped up to figure out how we could work combined with medicine to provide an opportunity to help. They were interested in kind of remote support for discharge planning across the health system to build in some efficiencies. And that's created a good opportunity for our students to get direct patient care remotely. It wasn't an opportunity before this. It just didn't exist. And so that's been an interesting development. And then we continue to seek and develop remote learning for experiential education to the degree that we can continue to develop those opportunities. It will be vital, I believe, in maintaining our capacity to continue to keep our students on rotations with the hope for an on-time graduation. And so Diana Langworthy is piloting what a remote acute care rotation could look like right now. And we're looking at what that takes to resource as well. So exciting opportunities. Next slide. And so I'm going to end with our gratitude to preceptors. We would not have gotten the class of 2020 to graduation if preceptors weren't willing to take students for 3 days, 5 days, 10 days, 20 days, depending on what their needs were. We were making rapid asks, and preceptors were responsive and sort of were willing to do all sorts of things. We are grateful to those who really increased their capacity this summer to support the class of 2021. You know, between some of the challenges we've had just as institutional-based health systems have grappled with how to handle all of their health science learners, we're very appreciative to the community-based sites that really stepped up to increase capacity. We're incredibly grateful to our preceptors that continue to advocate for their sites to reopen to taking for students, because without you, we need your voice. We need you. It's incredibly vital to help continue to work on, working with the health systems to come back online to continue to take students. And we're very grateful to those who are willing to learn new ways to precept in our world of remote patient care delivery. It's been stressful and crazy trying to figure out how to just do our jobs remotely, and then to layer in being willing to take a student remotely. We are incredibly grateful as people are getting more comfortable and willing to continue to take our learners. So thank you very much. And at this point, I'm going to hand it over to Dr. Seifert.
Sean, can you unmute Randy?
Thanks, Dr. Conway, and thanks to everyone who's here participating in this town hall today. What I'd like to do first is to express my appreciation of the Office of Student Services team who provide outstanding professional services every day, and to all of our faculty, alumni, mentors, preceptors who provide much needed support to our professional PharmD students and to our graduate students. Before I know that this is a rather busy diagram, and I'll walk you through some of the key elements of our student support programs. Before I do that, one of the questions that we ask ourselves and has come up is, how do we continuously adapt to the changes in student services due to COVID-19? And while COVID-19 has certainly impacted our Office of Student Services operations, and we've had to adapt to different ways of staying connected to our students, our student organizations. We have virtual celebrations and events with our virtual white coat ceremony and our virtual commencement ceremony. That actually went quite well, considering we were all virtual. And the students have done a great job in adapting to those as well. It has also changed how we approach admissions and recruitment, in that we moved all of those operations to remote virtual meetings and recruiting events. During spring semester, we conducted a weekly survey of students to assess how they were coping, and the purpose of that was so that we could keep our finger on the pulse of the student body and individual students in case we needed to intervene as needed. And in some cases, we actually did have to, but everybody struggled a little bit, but came through it really with flying colors. Despite this change in operations, we remain focused on our goal of providing the best support for our professional and graduate students. And so in looking at this diagram, I want you to take a look at this in the context of how we prepare and grow the most resilient and ready workforce, in that it's no longer just adequate for us to have academically successful students and graduate students and graduates, but to have students and graduates who will thrive in the profession and graduate programs and ultimately as successful professionals and in life. So to reach this goal, we've spent time listening to our alumni, our professionals and employers, and the message we have received is that all of our students are very smart, but we also want our graduates who are adaptable, flexible, show leadership, executive presence, good communication skills, and teamwork, among other human power skills. And so this is how we are and will differentiate our graduates from other schools. And that's why you see this rather extensive diagram on this particular slide. In this diagram, how we're approaching this is continually evolving. It is also not simply segmented into, just basic needs, academic success and thriving, but the support is really on a continuum. There are the processes and the support services that we have are continuous in here, and they're not just separated into 3 distinct events. We feel strongly making sure that our students have all their basic needs met are very important, and our attention to basic needs has really been heightened by COVID-19 let's make sure our students have what they need, and that includes shelter, to food security, to health and well-being, to financial support and good technology, so we can access the instruction that's going to be needed for their professional education. Now, some of the financial support comes from many of our alumni and friends who support our student scholarship funds. We have also found that many of our students continue to struggle because of the COVID-19 impact on internship and other employment. So we're utilizing some generous donations for an emergency fund to support the students, and we're administering that process through the Twin Cities main campus and the University of Minnesota Duluth. As you can see from the diagram, we have quite a spectrum of support services. Some of those things that are really important in growing a professional are things such as a sense of belonging. We've done some of this through support in our affinity groups. We have numerous affinity groups that are diverse in terms of diverse populations or diverse, including one that I'm a part of that's a first generation college graduate. So there's various affinity groups which are really functioning quite well, and it's helping our students to feel like they belong to an organization and to a group. We launched this last fall, and so far we feel things are going really quite well, and we'd like to see some actually greater engagement on the part of our student body. We're going to soon launch a program called MINPAC, and I'll tell you a little bit more about that in the next slide. Another important support service is making sure our students have enhanced well-being, and we do this through community relationships, good health, environment, and life balance. So those are things that are important, and making sure that our students, it's difficult for our students to learn if they're not feeling well, if they're struggling with mental illness or other kinds of health conditions, as well as the feelings of belonging to a community. As we focus on thriving, we address some different issues, including professional identity, career opportunities, networking, advocacy and positive change through engagement, our co-curricular opportunities such as mentors and our professional student organizations, and community outreach and engagement, things like code of ethics and building professional skills. Lastly, I'd like to point out in that final column that is gray, the resources, partners, and collaborations that are needed in supporting our services. And many of you that are on this call today are very much a part of that support service. Before I show you our MINPAC plan, I would like to apologize that we were unable to have a scholarship reception this spring, but we want to thank everyone for their scholarships and support. And as I mentioned briefly, the financial support is even more important now as a result of the pandemic, but is always important in supporting the next generation of professionals. Next slide, please. So one of the programs that we are launching this fall is a program we call MINPAC, and it's short for Minnesota Promoting a Connected Community. And really the purpose for this is to foster closer connections and a layered mentoring model, initially starting and sharing information to better understand the contemporary PharmD student experience. So we want to really be able to adapt and to learn more about the experiences that our students are having, some of the needs that they're going to be needing. And the way we're going to do this is that we're going to connect our students with each other in groups, as well as faculty, and as well as we hope community practitioners, participants in our alumni and practitioners in the community. And I'll explain that in just a second here. The reason for we're doing this is that we need to utilize this as meeting part of our accreditation standards 3 and 4. Our expectations, our outcomes that we're looking for is stronger personal connections, enhanced belonging and well-being, and a mutual understanding. So the program framework and format is that we're going to have 2 each of PD1s, 2s, 3s, and 4s paired with a lead teaching faculty to start this fall. So we're going to be enlisting about 79 to 80 of our faculty. So nearly all of our faculty, particularly those that teach in the professional program, to take a group, a family group. We are in the process and have had some conversations with the leadership in our Pharmacy Alumni Society and Century Mortar Club to add volunteer practitioners to each group as co-leads with our teaching faculty, because that would help make connections within the community as well. Our goal is not to make this extensive in terms of time commitment, but to have a minimum meeting once each semester. This can be flexible if more meetings are agreed upon. It depends. We're going to let each family group decide how they want to operate. We will have some fixed rotating topics, but plenty of time for open discussion and plenty of time for some mentoring if that's what the students and the faculty and other participants want to do. But the idea here is to build a community, a small community within a larger community, and for us to be able to get better information on the things that we may have to adapt to and what are our students saying about the experience that they're having here at the University of Minnesota College of Pharmacy. Next slide, please. A little bit about admissions and recruiting ongoing. Current enrollment for this fall PD1 class, we'll have 40 students who are assigned to Duluth and 93 students assigned to the Twin Cities. We probably have more than 2 campuses now. We probably have several hundred campuses as we look to doing our remote learning as well. So most of this will be online. We're doing a lot of work to continue to attract the best and the brightest to this College of Pharmacy. And so this will require future directions that include early pipeline development in high school. And some of the actions here is that we have some of our admission staff that are working with schools. We also have a faculty ambassador program. We'll be looking for a community ambassador program as well in order to be able to attract students early into an interest in the profession of pharmacy. The same will be true of our undergraduate pre-pharmacy students in the pre-pharmacy programs, and making sure that we have plenty of contact with them, and maybe advancing some issues as soon as we can that would allow for shadowing experiences or other kinds of connections, or actually learning more about careers. I had the experience this last fall of going to Waconia and speaking to the health sciences class with one of the teachers, and it was the first time that a pharmacist had been invited or had actually had come to talk to those students about the opportunities within the profession of pharmacy. And then we're moving along with a planned preferred admission. We have incredible success with the University of Minnesota Duluth in attracting students into our program from Duluth, and we want to expand that to other not only units within the University of Minnesota, but potentially elsewhere as well. And then we're launching a new streamlined application process and selection for admission that is far more holistic in terms of its actions than what we've had in the past. And one of the things that we are doing this year is we're making the PCAT an optional test for students rather than having them actually having to go somewhere and taking a test. So those are some of the things that we're doing in terms of our enrollment. So far, in terms of our some of our work that we've done, that Olivia Uncher and her team have done, has gone really well in terms of some virtual events and explaining to potential applicants the value of coming to the University of Minnesota College of Pharmacy. And I think with that, I'll turn it over to Dr. Varon.
Well, thank you, Dr. Seifert and our panelists. And thank you all for taking the time out of your day to join us for this session and for being part of our family. We did receive lots of questions from you, and we appreciate that. What I've tried to do is group them together to some extent for expediency. And many of the points of the questions may have been at least in partially answered. So I'm going to ask the panelists to drill down a little bit more if they see an opportunity to do that, to answer these questions. So, and then after we get done with these, we'll open it up to some of our live QA questions that we're receiving. We're going to send this first softball out to Dean Wellage. It's not really a softball, but many pharmacies have recently closed. Pharmacist salaries are declining. Pharmacy school applications are down sharply across the nation. What is the college's plan to continue to attract a full class of high quality students?
So thank you, Dr. Varon. Yes, that wasn't a softball by any means, but it's a very important issue for the entire profession. And I want to address it in a couple different directions and components. First is the concept there that was stressed at the end, full class and high quality. I think all strong programs in pharmacy need to decide what workforce needs are for the future and what they will look like, both in terms of different roles for pharmacists, but also the numbers, because we don't need to oversaturate the market in any way. We need to focus on high quality. And so we will never at the University of Minnesota jeopardize the quality for the numbers. And I say that very proudly to all alums, because you should be proud of that quality, because you are our market that sets the brand. It's what you've done with your careers. And so that's the second piece. We believe our brand is distinct based on all that you've done and how we approach the College of Pharmacy than other colleges of pharmacy. We focus on strong pharmacy skills, but we also focus on leadership. And then you heard Dr. Seifert talk about some of the new focus in a broader way. And so I believe we're different, and so we will attract students. The other piece is really thinking to the future. And that's where we didn't have time to go into it in today's presentation, but we're undergoing curricular revision, and what are the new areas, whether that be pharmacogenomics or informatics or medical affairs or artificial intelligence. How do they interface with pharmacy? What is we know the issue of telehealth is growing. How do we embrace that from a pharmacy perspective and a pharmacy education perspective? I think all of those pieces, as we shape a new curriculum, as we have a different brand, and by focusing on quality with high quality graduates out there as the example, will lead to the pool of students that want to come here and have that lasting degree from the University of Minnesota.
Thank you very much, Dean Wellage. Dr. Conway's job has gotten somewhat exciting and interesting over the past few months as she as she mentioned, we've gotten a lot of questions regarding the game plan for coursework as well as experiential. So I'm going to kind of group 3 questions together and ask her if there's anything that slipped through the cracks. I think some of this is in process of being solved, but anyway, if a single student tests positive for COVID-19, will the balance of the class also be tested? For students that test positive, does the college have a plan in place to support the students to stay engaged in their classes and complete their coursework? And finally, what measures is the college taking or will take to monitor students' ability to succeed in learning during these unusual times?
All right. Okay. So the first one for part A was about if a student turns positive, will we test others or how will that be managed? So we are fully planning on adhering with the evolving science that comes from the CDC and the Minnesota Department of Health. And so with that comes some limitations to testing right now. So, the intent would be, we're trying to truly limit student time together. So it would be in lab or an experiential type thing. So they won't be in a large group where we need to clear out a classroom and deal with a large number of the cohort. And in lab, we are just getting more directives from even the Environmental Health Service in terms of what we would have to do to decontaminate. So certainly we're working through the communication plans, what we can and can't share, similar to employees and what we can and can't disclose. We're working through what that would look like for students if need be. And certainly students would be informed. We're anticipating there would be contact tracing. And so if the CDC guidances are after so many days have an individual exposed be tested, we would be following those guidances. The second question was how to keep students engaged if they end up being positive. Our hope is and the way lab was being structured, it will truly be unlike how lab was probably when you were in school, where it was, weekly sessions. It truly has been honed in on what students need to come to campus and demonstrate. And so they'll be signing up for appointment slots depending on the year and the course. And so the space in the lab will be socially distanced. They will be masked. They will be face shielded. So will the TAs, so will the faculty. And so we will work with students if they get sick, much like we do when a student has any sort of unexpected illness, right? So we work with them to extend deadlines. If need be, they'll get an incomplete, but we would support them similarly as if they needed to have their appendix removed and had to take a couple weeks off. I'm not anticipating a decrease in student support in that regard. We would only increase our support. And in terms of monitoring for students, that's going to be in partnership with Dr. Seifert and OSS, and using a combination of faculty keeping tabs on academic performance along with our student services keeping tabs on the other kind of student, whether it's the check-ins or periodic surveys, because we recognize that it may not be academic challenges students have. They may have other challenges, just being isolated and working in a curriculum in a way they hadn't anticipated, and they may not thrive. So we will be, reaching out and adapting support services to the degree that we can. I think I got it all.
Thank you very much.
Yeah.
There's a lot in there. So this next question makes me very proud to be not only part of this college, but part of the family in Minnesota, because some of the questions that came in were not what are we doing as a college, but how can the external community help the student experience. So this one I'm going to send to Dr. Seifert. How can alumni and friends of the college provide support for student pharmacists during these uniquely challenging times?
There we go. Well, thanks for whoever asked that question. Thank you for asking that question, because one of the most valuable assets that we have in terms of this College of Pharmacy is and has been our alumni, and the amount of engagement that our alumni have had in supporting our students. I think in terms of this unique time, the more positive connections and networking, whether it's virtual or if it's live on the job or in some other venue, is incredibly important. Because we're all somewhat isolated, that human connection, I think, is really going to be important. That also goes to, the critical need to have a strong mentoring program, which we are working on with both the Century Mortar Club and the Pharmacy Alumni Society leadership to come out with a plan for that. But mentoring, networking virtually, to continue to have some normalcy of what we've had in the past with whether it's a virtual happy hour connection of some sort. But I really truly believe that continuing as many connections with our students so they don't feel isolated, as well as the rest of us don't feel isolated, is really the most important support that our alumni can do right at this point in time.
Thank you, Dr. Seifert. So I'm going to give Dean Wellage a twofer here. There's discussion about students having to pay in-person tuition for online coursework. Do you see an increase in in-person tuition, a decrease in online tuition, or something in between? And will there be any differences in policy and procedure between the College of Pharmacy and the University of Minnesota as a whole?
Thank you, Dr. Varon. And let me start by addressing the tuition question. And obviously, if you read any paper throughout higher ed, that is a discussion both related to tuition now due to COVID, but also tuition in general related to higher ed. And I'll take two prongs on that from the college standpoint. We recognize and are committed to having top educational experiences, and that is not changing. I think that is not true of all colleges of pharmacy, likely, and it's clearly not true of all colleges throughout the United States. We actually have more experience than most in online. We've had 2 campuses for over 16 years. And so we came into this with experience. As Dr. Conway said, we gained a lot of experience very rapidly. And now we've had a period of months over the summer really to build on that faculty development that faculty have to sharpen. How do we do remote? How do we do online? How do we do hybrid in a better way to better support our learners and prepare them to be stellar pharmacists in the future? And so with that, we don't envision at this point changing the tuition. We did, similar to the university, hold tuition flat for this year, but I will actually say we plan to hold it flat before COVID even happened. And so that was based on the issue of higher education, the issue of pharmacy salaries going down, and the high cost just of going to pharmacy school. And so we are looking at ways, obviously, to do that in the future or have minimal increases in the future, while enhancing our efficiencies and decreasing our costs. So tuition is always on the forefront of my mind, but I think it's not whether you're online or face-to-face, it's really the product you get and what you become as a graduate. And I believe our students will become great pharmacists and great scientists in the future. In terms of the second question, differences in policies and procedures, yes, there are differences, but for the most part, they're similar. And I'll try to give a couple of examples there. We're using the guidances from the university and from the public health officer, VP Jacob Toller, to help shape our plans. And so the university says masks are required in buildings on campus, we are supporting that, and other things such as in terms of safety and how to do it and how to communicate it. But in other cases, we've always been different, and they're allowing us to still remain somewhat different. And so classes start this year for undergraduate education after Labor Day, but our classes have always started earlier, and they will start earlier in August again this year. I will say overall, we have really an alignment of talking through these things and what should be identical, what should be similar, what is the philosophy, and where can differences exist, because professional schools are different than undergraduate programs. And our students do need to have experiences in the experiential setting or in research labs that isn't as common for undergraduate students. So we work through it with the university.
Thank you very
Thank you.
much. Dr. Conway, I know you've touched and answered most of the components of this next question, but I'd like you to just maybe drill down on any points that you may need to elaborate on. There are many other questions submitted about student rotations during this pandemic. Could you share your thoughts on expectations, challenges, opportunities, and how the college and our preceptors have made adjustments to facilitate APPE rotations?
Yeah, so one of the first adjustments we made, as we discussed as a team and then brought it to the faculty, was we had previously structured our fourth year almost as like these semester-long clumped together courses, right? So you had your community and your AmCare, and those 3 rotations were together. Acute care was 12 weeks of a full semester, and electives were blocked together. And so we knew we were going to have to be more flexible and more nimble in terms of what was available, given what was available and what else we could recruit for students. They needed to be able to do a community and then an elective and then maybe acute care. And so we really looked at what accreditation said, and we exceeded accreditation minimums by 6 weeks. And so we really adjusted to ensure that we could maximize all of our students getting to the ones that were must-dos in order to graduate. So you need 4 weeks in a community pharmacy, you need 4 weeks in institutional practice, 4 weeks in internal medicine and acute care, and you need 4 weeks of ambulatory care. And so how could we build that out to be the most responsive for students and preceptors? And so moving forward, we're also looking at so one of our big challenges we're facing now is we normally would have students between their second and third year doing their institutional IPPEs. They had 3-week rotations in the summer between years 2 and 3. We knew those sites weren't available. On block 1 this summer, we had 8 students that made it on a hospital rotation. Block 2, we've got, I think, 15 students on a hospital-based rotation right now. So we're going to need to partner, and we have a new assistant dean of experiential ed who's been working with our team and faculty and staff to really, we're going to be reaching out soon to work on an iterative shared model for how we're going to build these IPPEs into the academic year, and really continue to provide students these great opportunities to work with all of, one of our biggest strengths is our preceptors and the quality of those experiences our students get. So we're continuing to work on, and so everyone stay tuned, because I'm sure in the next few weeks there's going to be more things happening, because we're not done, for sure. We have more work to do.
Thank you. And we have time for one more question. So since I'm going to ask Dean Welledge to close us out after she answers this question. The question is, obviously the pandemic has changed many aspects of our lives. What do you feel are the biggest opportunities created by this pandemic for the college, its students, and the profession?
So I'm going to categorize it in 3 lenses. First being the opportunity to be more open to change and be flexible with an eye towards simplification and building a new future. And I think the experiential education piece that Dr. Conway just talked about highlights one example, but I think there are many. I think the second is the opportunity, and we've seen this, of adaptability, resilience, and connectedness, despite being physically apart. We are together, although we're apart. We're working to support each other while meeting the needs for the future, and that is with our alumni and friends of the college, but all of our students, faculty, and staff, and the greater pharmacy profession. And then the third piece, I believe, is the changes we're seeing in healthcare, and we're seeing regulatory simplification or streamlining, and telehealth. Never thought CMS could do it overnight, and basically they did it overnight, and it's now a funded activity. But there's also greater recognition for pharmacists and their what they can do by the public and by healthcare professionals. And so it's our time to seize that opportunity and move forward with the profession and partner in that way. And so I think there's great opportunities. Every disaster sometimes has some opportunities with it, and I think we're trying to look beyond the pandemic to our future. I would to thank all of you for joining us today. I want you to visit our pharmacy.unm.edu news to stay up to date. This won't be the only town hall. We won't bombard you every week with town halls, but we will plan other town halls and other activities. Somebody already used the word happy hour and get-togethers, but you're an important piece of the college in supporting our students, in supporting our future direction, as well as shaping the profession. And so please continue to watch out, join us, and at any point, reach out to any one of us and share your thoughts and ideas. Thank you very much for joining us.